Hey guys, my name is Kaylee Patterson and today I'm here at Southeastern Aesthetic Surgery by Dr. Troy Austin to consult about a breast augmentation.
Alright, so I do have some new patient forms for you to fill out. There you go, Missy. Kaylee, that's me.
Good to see you.
Good to see you.
So, you're here to talk about breasts.
Yes.
Okay. So, looking to go bigger, I assume.
Yes.
So, tell me exactly what your goals are. More fullness, better shape, better symmetry.
I'm thinking more fullness. I did a few bodybuilding competitions and at the age of 21, I just feel like they're not where they need to be.
Okay. And your ideal size?
I'm not really sure, just something that kind of fits my figure.
Excellent. Okay. So when we do breast augmentation, obviously we're looking to improve shape, symmetry, proportions, and probably the best choice as far as going with size is concerned is to stay something that's in the realm of body proportions. So do not over augment, do not under augment. So when you under augment, you have buyer's remorse when the swelling comes down. When you over augment, you either look like you had a boob job or you look fat. So not a whole lot of in between. So we're looking for both short-term and long-term happiness with your breasts. We don't want to do anything that's going to accelerate tissue damage. We want to make sure that we meet your goals and make them look beautiful.
Awesome.
Okay? So when we talk about doing breast augmentation, so we augment the breast with implants. You know, there are some people that are starting to do fat transfer to the breast, taking fat out of the parts of the body where you don't want it and put it in the parts of the body where you do want it. In my opinion, we're still kind of in their learning stages on this right now as far as long-term viability and potential risk for breast cancer down the road. I wouldn't recommend it at this time. Okay, and those recommendations may change in the future. So for now, we'll use implants. There are two basic types of implants. We have our saline implant and our silicone implant. Our saline implant is basically a silicone bag filled with salt water. A silicone implant is a silicone bag filled with silicone gel. They have their advantages and disadvantages. So starting with a saline implant, first advantage is it goes in as an empty bag and it's filled up on the inside. That opens up options for smaller incisions or different incision locations if your surgeon is willing to do them. As far as saline implants are concerned, we need tissue coverage to hide the implant because the implants are not exactly smooth and soft. So to get tissue coverage, we put the implants under the muscle. We raise the pectoralis major muscle off the chest wall. We create the pocket, we put the implant inside. Okay? The implant is not completely covered by the muscle though. So the top part of the implant is covered by the muscle, breast, and skin. The bottom part is only covered by breast and skin. It's in what we call a dual plane pocket. So two tissue planes. Where people have issues with this type of procedure is the bottom part of the implant. Okay? So if the tissues are thin down here, the problem we see with the saline implant is they tend to ripple when the volume shifts, okay? Especially when you lean forward. This is probably the #1 complaint about saline implants. If you have the tissue to hide it, it's not so much of a problem, but most people don't. So where the primary disadvantage of a saline implant is the look and feel of the implant, the primary advantage of a silicone implant is the look and feel of the implant. They are polar opposites. With a silicone implant, they're nice and smooth around the outside of it, and if you're gonna feel it through your breast tissue, it feels like breast tissue and not a fake plastic poppy implant. You can have a feel and see what we're talking about. Okay? Most people, when they feel this, it's a pretty easy decision. 2004, plus or minus, the implant's got a major upgrade. So it used to be liquid silicone, now it's solid silicone. So if you took a knife and cut this implant in half, you have two halves of an implant. The inside of it looks like a gummy bear. They got the nickname gummy bear implants. Okay? So now if this implant were to rupture inside the pocket, the particles are too thick to migrate out and spread anywhere. They're going to stay contained inside of the pocket. So now we have an implant that we know is safe and it's not a mechanical difficulty to clean out if they were to rupture. Breast implants are not permanent. At some point down the road, they need to be changed. The old answer was, based on high rupture rates of the old style silicone implants, about every 10 years. The new answer is, we're not quite sure yet, we're still working on the data, but we know we have very low rupture rates at 10 years, ranging around 5 to 15% depending on the implant manufacturer. My recommendation, based on what I've seen in my surgeries, changing the implants out every 12 to 15 years. Usually it's a very straightforward operation. Go back in through the old incision, open the pocket, change out the implant, maybe tighten a little bit, go a little bit bigger, a little smaller if you want to, put a new implant in, call it a day. Straightforward breast augmentation is done in the operating room under general anesthesia. You're asleep for the procedure. You go to sleep, dream about big boobs, you wake up, you have big boobs, it's a dream come true. Now the recovery after breast augmentation is very quick. In fact, it's a little bit too fast. You recover before you're healed. We talk about a 24-hour recovery after breast augmentation. It's a pulled muscle pain. We're pulling the pectoralis major muscle off your chest wall. We're putting an implant under it. When you wake up, the muscle wakes up. And when it does, it squeezes the implant, okay? But it's on both sides. So best pain medication for breast augmentation, ironically, is ibuprofen. Also allows you to recover a whole lot faster. Don't go home and curl up in a ball. You'll stay tight and sore for a very long time. Go home and move your arms, okay? We work through pulled muscles. Just don't do any heavy lifting, pushing, or pulling for the first 6 weeks or so. Allow them to heal and settle into position. As your breasts heal, okay? I have one rule with this. Keep your shirt on. Don't go show your friends what Dr. Austin did until I give you the green light, okay? We put the implant in under the muscle. The muscle is released from the bottom part of this. When you wake up, the muscle wakes up and it squeezes that implant. The implant rides up on the chest. Okay? And then you're gonna swell on top of that. One's gonna swell more than the other one. From the front, nipple position, it looks a little bit low relative to that fullness. One's lower than the other one. And the breast looks a little bit square. You look down and see breasts, you're excited. You look from the front and show your friends are, who did your surgery? Dr. Austin. No thanks. Over the next 4 to 6 weeks, the muscle will relax, the implant will settle into position, nipple position will come up, swelling will come down. One will get there before the other one does. When they both catch up with each other, show all your friends. You're my best form of advertising. Any questions about breast augmentation?
Nope, I think you covered everything.
I hope so. All right, well, I'm gonna step out. We'll let you change. We'll take a look and see what we got, okay? So I'm gonna have you stand kind of right up here in front of me, right in front of the mirror so you can see what I see, okay? So about how tall are you and about how much do you weigh?
5'5", 145.
Okay, all right. Stand nice and straight, hands right down by your side for me. So always kind of like in different habits. One shoulder sometimes sits a little bit higher than the other one. Chest wall makes a big difference. It kind of adds to what you're perceiving as symmetry versus asymmetry. Okay, some things we can fix, some things we cannot. Now, so we talk about what we're looking at here. Okay, so breast position is actually fairly good. Nipple position is a little bit on the low side though. Okay, so we talk about where the breast implant is going to sit. It sits basically from the fold under here up over the breast this way. So as the implant comes under the muscle, it's going to pull the breast tissue up somewhat. Okay. Now, if we talk about do we need a lift or no lift, it's where nipple position sits relative to the fold more than anything else. Okay. So if we put our finger on the fold here and see where the nipple sits, you can see across the top of my finger where the nipple sits. You're kind of right at that level. So you're kind of in between needing a lift versus no lift. Now, there are certain things we can do on the inside to try to avoid a lift, and we'll kind of go over all that kind of stuff as we go. Okay, so I won't bore you with the details of that, some of the technical things that we go through in the operating room. But the incision is going to be under the breast, right up under here. You don't see it from the front, you don't see it from the side. The only time you see it is when you lay on your back or you raise your hands up over your head. The scar does extremely well when we place it under the breast because it follows the lines of minimal tension. If it scars poorly, you'll see it every time you look at your breast in the mirror. You'll think negatively on me. Okay, so if we can avoid doing a breast lift and just do the augmentation, any chance we can get, we can hide the scars. Our goal in the operating room is to reduce that asymmetry. The only time the breasts are really perfectly close to symmetrical is in the operating room. Both before surgery and after surgery, the larger breast is going to respond more to weight fluctuations than a smaller breast, and that asymmetry is going to kind of show its head a little bit. But difference is after surgery, I see the asymmetry, but most of the time the patient does not, okay? Unless I open my big fat mouth. Questions for me? Okay, so what we'll do now, basically we'll have you get dressed. Erin is going to put everything together for you as far as pricing and all is concerned. She'll come back and get you, take you over to her area. We'll meet again next time at your pre-op appointment. At that time, basically, you'll have a good idea of what you're looking for in your mind's eye as far as what size you want to be. I'll measure your breasts. I'll take into account your basically chest symmetry and everything else. Choose the implant. It's going to basically be what's right in your mind's eye.
Okay.
Okay.
All right. Sounds good.
All right. Yeah.
Thank you.
Very nice to see you.
Nice
yeah.
to see
We'll see you soon.
Cool. All right.
here. Right here, my dear. All right, pick a seat wherever you please. All right, I'm Erin. I'm his surgery coordinator. I kind of take over from here. I'll go over the pricing structure with you, show you some before and after pictures, and I will help you schedule and get this journey going.
Cool.
So I always kind of cut to the chase. Everybody wants to know how much the cost is, so let's kind of go ahead and just get that out of the way. And one of our own actually from here actually goes with him as well. We have our surgeon fee of this amount. Don't go buy expensive bras until you're at least 6 months out.
Okay.
Because you're gonna see things are gonna change. But generally he'll let you get back into underwire bra at about 3 months out. Everybody always wants to kind of squeeze them. You can do a lot with implants. You can beat them to death. But it's just a matter of personal preference. They both have lifetime warranties. And a lot of people don't know this about implants. As long as you have these implants in, if you ever have any issues, mechanical failures with the implant themselves, then they are replaced for life. And I give you a brochure on them, all their warranty issues and everything that come along with it. So you can make a good informed decision which brand you want to go with.
I really, really love the way this one feels. It feels really nice.
They are quite, and this company actually has a 20-year warranty with their program, so they assist you with any financial expenses if there's a mechanical failure. I like them too. It's kind of just a difference in the shell, but again, it is personal preference, but we can definitely set that up. Dr. Austin will help you on your pre-op appointment, which I'll schedule 2 weeks prior to surgery. He's going to do all your measurements, and he'll help you with what size to go with based on your personal preference. And we're going to do a little boob shopping in just a second, so I can see what's in your head.
I just did my consult with Dr. Austin. I'm super excited. I literally did not even have any questions for him. He covered everything, so that is so awesome. Makes me super confident in him, and I love everything that he had to say.